if you know anything about dyslexia, you know Dr. Sally and Bennett Shaywitz. Their body of work is amazing over the last several decades, and they are with the Yale Center for Dyslexia and Creativity. They started this work when they were teenagers, and it's been the foundation for the work at Louisiana Key Academy and the Dyslexia Resource Center. So I'm thankful to have you both here, Dr. Shaywitz. I think first say a little bit about your work, a little bit about why you are the experts.
Well, I'm a developmental pediatrician, and Bennett is a child neurologist. And we became very interested because we saw so many children struggling and not being really helped. And as we got to know the children and their families, we became attached. We're both elected members of the National Academy of Sciences. And the more we looked at it and the more we understood, we found that, well, there has to be a larger understanding in schools and in the population. And also, as we got to know the children and their families, we knew that something had to be done. And something was available, the science, but it wasn't being used. So what we did is we did some studies, we published them, and we learned that dyslexia is extremely common, particularly in young people, 20%. That's a lot. And not that much was being done for them. So there's a lot of knowledge, but now we need action. And I must say, one of our great pleasures has been working with Dr. Laura Cassidy, who has just been terrific. And usually threes aren't great teams, but I think the three of us make a great team. And bless Dr. Cassidy, we feel lucky to be with her and to work together.
Thank you. So, and we know that a lot of your work was done from the findings on the longitudinal study, the Connecticut longitudinal study, which has been going on for decades. But today we want to talk about another paper that we published together, and that is really looking at the prevalence of dyslexia in the African American community. So let's start that discussion. And you both were on the paper. Let's talk a little bit about our findings and what you think that means for dyslexic children in the African American community.
So this paper that was done by Laura, the data was collected by Laura, and we were happy and privileged to collaborate with her on this. And it was just published within the last few months, and it's titled "The Prevalence of Undiagnosed Dyslexia in African American Primary School Children." And what Dr. Cassidy did was to go into a school in New Orleans that was predominantly African American. She studied grades kindergarten through second grade, and she used a screener, an evidence-based screener. It was our Shaywitz Dyslexia screen. And she first screened this group of kindergartens, first and second graders, and found that about half of this very poor inner city population of kids screened as at risk for dyslexia. She and her team then went in, got permission from the parents of the kids who had screened as positive, and examined them in more detail. And she found that the majority of the kids that she screened as at risk for dyslexia were in fact dyslexic. And that was a remarkable finding. And remarkable for a couple of reasons. One, it suggests that the prevalence of dyslexia in African American kids is much higher than the prevalence in the general population of kids. So in previous studies, Dr. Sally Shaywitz and I and our colleagues at Yale had used the Connecticut longitudinal study to determine that about 20% of the children from this randomly selected group of children, which we've been following since kindergarten and now in their 40s, about 20% of that group of randomly selected children were dyslexic. And that meshes reasonably well with other findings. But this finding that Dr. Cassidy's team found in this inner city New Orleans schools is really remarkable in the sense that 50% of the African American kids in this inner city school are at risk for dyslexia, much higher than the general population. And so this is really a wake-up call. And as we reviewed the literature, what we found was that previous studies done by the federal government, so-called Nations Report Card, the National Assessment of Education Progress. So every couple of years, the U.S. Department of Education does cross-sectional studies of a few thousand children in 4th grade and 8th grade and 11th and 12th grade in schools, cross-sectional studies of schools around the nation. And since 1992, when they started to do this Nations Report Card, it turns out that if you look at the number of kids, African American kids, who are reading below basic, the NAEP metrics are somewhat different from the usual standardized testing. NAEP groups the kids as reading reading average, reading above average, and what they call basic, and then reading below basic. And if you look at those studies, beginning in the 1990s, but more recently in the 2000s, it's clear that about 20 to 30% of the white children are reading below basic, but over 50% of the black children are reading below basic. The children who are reading below basic are in fact those children who modern metrics of reading would be considered to be dyslexic. And so not only do we have the findings from Dr. Cassidy's study, but we have the findings from all of this NAEP data for the last 30 years, which says that this high percentage of children who screened as at risk for dyslexia, more than 50% of the African American kids, it's correct. What Dr. Cassidy's findings did was just highlight what the federal studies, for some reason, have been reluctant to highlight, and that is that large numbers of African American kids are at risk for dyslexia. And the sad thing is, they're not being diagnosed. So that was the message of our paper. And I think that it's an important message. We really need to get the word out, because we can screen for dyslexia, we can identify it early, and we have very, very good interventions. A variety of interventions, graded interventions that go all the way from giving kids a little extra help to specialized schools like the Louisiana Key Academy. And we should really get the word out. There seems to be this reluctance to sort of say, wait a second, why aren't these children identified? And part of the problem is, I think, the definition. Dyslexia has always been an unexpected difficulty. Since the original description in the late 19th century, the 1800s, where the very first description of dyslexia by a British general practitioner was really promulgated in the medical literature.
So Morgan was a physician, and in 1896 in the British Medical Journal, he published a description of one of his patients, who described as a well-grown lad, age 14, who's always been bright and intelligent, quick at games, and no way inferior to others of his age. His great difficulty has been, and is now, his inability to learn to read. And the schoolmaster who taught him for some years says that he would be the smartest boy in the school if the instruction were entirely oral. So there's a history of dyslexic children being noted to be bright. So, and that it wasn't a deficit in intelligence.
And so I think what we're saying is that there's misunderstanding about what dyslexia is. And part of it is, if people understand these are bright kids with average to above average IQs that have this isolated deficit that leads to their struggle in reading, they have this incredible path before them because they have so many strengths. But if they're not identified, they're struggling in school, they don't know why they're struggling, and they're more likely to drop out of school and obviously more likely not to go to college. They're not going to reach their potential. Dyslexia is not a cultural disease. It's not an economic disease. As the old definition said, it is neurobiological.
It's very important for people, young people who are struggling, to know that the reason they're struggling has a name, dyslexia. And it means that they're not stupid. And we're depriving so many children of their future and our country's future by not identifying the children. People have gone into prisons and examined prisoners and found that about half of them are dyslexic.
We need to figure out how to get this word out to the communities. How can we, let people know the truth about what dyslexia is? How do we go about letting people know that?